Hi, I'm here to explain to you how to put a BiPAP mask onto a baby and a young child. First of all, CPAP and BiPAP are support for spontaneous breathing patients only. It gives a pressure to help expand the lungs for better oxygenation and decreased work of breathing. So the first thing we have is our properly fitted mask. The mask size will be done by the respiratory care practitioner. When you are ready to put the mask on the baby, we need to protect the skin, so we're going to use Mepilex on the baby. I have pre-cut some strips and I'm going to put them on the baby so you can see how this is done. Okay, so we have our pre-cut strips. One goes across the forehead. One goes on each side of the face, from the corner of the mouth to the edge of the strip across the forehead. And it doesn't have to be an exact cut, as long as where we put the Mepilex, that the mask is sitting on the Mepilex. So we're protecting the skin integrity at all time. And one under the chin, so you can have a nice look at how we are here. Now, this is what we use on the small babies. We call it a scuba mask. To open it, it just pops off. I find the easiest way to do it is to put the Mepilex on and then hold the mask on the baby's face over the Mepilex. If you look, you can see that it's sitting on the skin protection, not on the skin. And then I take the headpiece and fit it in place. And this just snaps down. You notice I'm still holding the mask on the baby's face so that it stays in place. After that is done, we tighten it so that it's snug with some give, not very, very, very tight. We have a really little baby on this mannequin. There's 4 places to tighten this mask, one on each side of the chin and one on each side of the forehead. So we pull it till it's snug. The way we can tell if we have a good fit is we still should be able to fit 2 fingers under it. And when we turn the BiPAP on, it should be able to move a little bit. So I'm going to turn this BiPAP machine on that I have over here. Give it a second to go through its gyrations. And we need a connection. I think we need a 15.
Go.
You ready? Okay, so we have our connection. This is our hose from our BiPAP machine or our CPAP machine. They both function basically the same. This is not staying as well as the actual thing will be. This is just for demonstration purposes only. So now we have the baby on the CPAP, and as the baby spontaneously breathes, we should be able to see a little bit of movement, so we know that the mask is snug but not too tight. Now we're back to put a CPAP BiPAP mask on a pediatric child. We've gone over the infant. The same procedure applies for all patients. I have pre-cut 3 strips of the Mepilex, and I'm going to apply them for this full face mask on this pediatric patient. Remember, no matter what size patient we have, whether it's a baby, a child, or an adolescent, they all get the same skin protective. So the first strip is going to go from the bridge of the nose to the corner of the mouth. And we're going to repeat that on the other side of the face. And the third strip that I have pre-cut here is going to go under the bottom lip on the chin to protect the skin down there. So if you remember what the baby looked like, we have pretty much the same configuration, just on a little bit older child. To put the full face mask on, we're going to place it gently over the Metaplex, just as before, and slide the headgear under the child's face. It will work best if you have one side clipped previously. They do fall off sometimes, just as this just did. Clip both sides. Now the child can breathe through this because this is open here, so you don't have to worry about the child not breathing until you get it fit. Tighten the strips on the end, and then tighten the strips at the forehead. There is some cushion here, and that should just rest gently on the forehead. This prevents too much pressure from being put on the bridge of the nose. And we want it to be snug, but not so tight that there's not some give when we turn the machine on. So I'm going to turn our BIPAP machine on once again. Always turn the machine on before hooking it up. And there we have our pediatric patient with a full face mask, all set, ready to go. The same procedure when we want to take it off the patient for any reason. Unsnap one side, lift the child's head up gently, pull the mask out, and then after it's off the child, turn the machine off. Each time we replace the mask on, put the patient on the BIPAP for naps or bedtime, the Metaplex has to be reapplied each and every time.
Okay.
We just went over fitting a full face mask with the Metaplex on a pediatric patient. To use a nasal mask, I'm going to remove this strip from the chin, because our nasal mask is much smaller. It's just going to go over the nose only, not the nose and the mouth. And I'm going to replace a smaller strip of the Metaplex between the nose and the upper lip. So you see that's where the pressure of the mask is going to be sitting. So same procedure, put the mask on the patient, fit the headpiece. This particular headpiece doesn't have a snap. It loops through a little connection place here, and there we go. And again, it doesn't have to be snug, just close to the face, so there's not too great of a leak when we do the numbers check on the machine, and it should have some give when the patient breathes. And that's that. So to turn this machine on, we push this on and off button once. The screen will light up, and we'll see it go through its startup pre-check sequence. This should always be turned on before you put it on the child. So once it's turned on, you'll see the mode, which on this one is CPAP, respiratory rate, and tidal volume. I will simulate the mannequin breathing so you can see that when it is hooked up, there are numbers that will show up on the screen. The respiratory care practitioner will come in and record these numbers when they do the checks. If you hear an alarm, this button right here is the alarm button. You would just push it and it'll silence the alarm. Most of the time when that alarm goes off, either the mask is off the patient, it's slidden off of the proper position on the patient's face and there's a huge leak, or it's totally disconnected from the patient. If that is the case, put it back on the patient. If you have problems doing that, call your respiratory care practitioner. When you are finished with the baby and you're going to turn the mask is off and you're going to turn the machine off, you just push this on and off button again and the machine turns off. So our baby has been sleeping nicely with the CPAP or BiPAP on, and it's time to wake the baby up, or we need to do some cares on the baby. The best way to remove the mask is to take one side of the mask and just pull it with your thumb and disconnect it. I will do it again. Just put your thumb here, pull it, and unsnaps. It's really only necessary to unsnap one. Hold the baby's face gently, lift the headgear off the back of the head, and just remove it. This way, there's only one strap that's been disconnected, and it will make it much, much easier to replace it on the baby the next time you need to do that. Once you get it off the baby, that is when you turn the BiPAP, the CPAP machine off.
Okay.
We just went over fitting a full face mask with the Mepilex on a pediatric patient. To use a nasal mask, I'm going to remove this strip from the chin because our nasal mask is much smaller. It's just going to go over the nose only, not the nose and the mouth. And I'm going to replace a smaller strip of the Mepilex between the nose and the upper lip. So you see that's where the pressure of the mask is going to be sitting. So same procedure, put the mask on the patient, fit the headpiece. This particular headpiece doesn't have a snap. It loops through a little connection place here, and there we go. And again, it doesn't have to be snug, just close to the face so there's not too great of a leak when we do the numbers check on the machine, and it should have some give when the patient breathes. And that's that.